The COVID inquiry has been told that Matt Hancock wanted the ultimate say on who should live and who should die if hospitals became overwhelmed during the pandemic. Lord Simon Stevens, the then boss of NHS England, outlined what he called this horrible dilemma. Our political correspondent Harry Horton is in Westminster. And Harry, there is a lot of focus, isn't there, on the former Health Secretary?
Yeah, there is, and there has been throughout the week lots of criticism of Matt Hancock. Now, Simon Stevens, who is speaking today, who was in charge of NHS England for most of the pandemic, was actually fairly polite about Matt Hancock during lots of his evidence. However, in his written evidence, he outlined modelling before the first lockdown that suggested perhaps as many as 800,000 people could die. And in that scenario, Matt Hancock decided it would be he who would decide how care was rationed. In other words, he would decide who would get to live and who would get to die. And Simon Stevens was asked what he thought about that today.
Did you have a view as to whether that was an appropriate line for him to take, desirable or not?
I thought it would be highly undesirable other than in the most extreme circumstances, and you can argue that these are the most extreme circumstances. And that is one of the reasons why the Department of Health and Social Care, I think, created a ethical and moral advisory panel to sort of ask the question, you know, if absolute disaster strikes, then how would you ration care?
Well, Matt Hancock will give evidence to the COVID inquiry later this year. He'll get the chance to put across his version of events, and we're also expecting evidence from the current Prime Minister Rishi Sunak and the former Prime Minister Boris Johnson, both expected to testify before the middle of December.
Harry Horton in Westminster, thank you.